All right, we are officially recording, and that legal disclaimer is now in your chat box. Welcome once again. My name is Robin Harris. I use she, her pronouns, and I'm speaking to you from Olympia, Washington, on the traditional and stolen lands of the Coast Salish peoples. I'm joined by my colleagues Micaiah Guy, Mary Van Verst, Jenny Benson, Thomas Darnell, and Lou Thompson. Mary, Jenny, and I are part of the program officer team here at Serve Washington. Thomas is our network's fiscal grants officer. Lou is the commission's performance management analyst, and Micaiah is our new director of equity and grants. Big shout out to Micaiah, who will be taking the reins of all things grant making after this call. Our entire team will be supporting the call today. It's a little bittersweet for me personally. If you know me, this is the last call, as I am the outgoing lead on grant making and previous senior program officer. And for those of you that have worked with me over the years, I just want to quickly say it's been an absolute pleasure supporting each of you in your organization's journey through national service. You are in excellent hands with our team that is here today. So back to the script. We sincerely appreciate your interest in AmeriCorps funding and in exploring ways that you can leverage national service to meet and address local needs. We have 5 objectives that we would like to tackle today during this technical assistance meeting. We're going to provide an overview and the purpose of AmeriCorps state funding, explain who is eligible to apply, outline the process and timeline for applying, review some key highlights to this year's application and offer some helpful hints and tips and reminders. And lastly, and probably most importantly to you, answer any questions you have of us. Additionally, we will also be talking about a new agenda item this year. There is a special notice of funding opportunity called Public Health AmeriCorps. And after the general presentation and Q&A, we will stick around for anyone that wants to know about PHA, Public Health AmeriCorps, how it's different, how it's unique, but for the most part, it is the core concept and has the same national service foundation. Before we get too far into it, I want to show a video titled, "What is AmeriCorps?" Please note this video was created a couple of years ago, but for our national headquarters, went through a big branding and logo change. So this is now considered our legacy logo.
Questions about AmeriCorps? Well, you've come to the right place because we're here to help. First off, let's clear up one thing right away. You might be wondering how to say or spell AmeriCorps. Sometimes people pronounce the P, but don't make that same mistake. AmeriCorps is alive and well, just spelled with a silent P. So think of Apple Core or Core of the Earth. Now that we have that clear, what exactly is AmeriCorps anyways? AmeriCorps is simply Americans of all ages and backgrounds dedicating their time and skills to get things done. There we go. So how does AmeriCorps get things done? More than 80,000 Americans across the country join AmeriCorps each year, and all of them are tackling different problems in different ways. For example, AmeriCorps members help families attain affordable homes. They mentor students so that they stay in school. Perhaps there is a tornado, a flood, a forest fire, or a hurricane. AmeriCorps members also help communities recover from disasters. There's so many more things that AmeriCorps members do, but if we said it all, we'd be here all day. Why do we call them members, you ask? AmeriCorps members spend anywhere from 3 months to a year dedicating their time and skills to serve. They can volunteer with nonprofits, schools, public agencies, and community and faith-based organizations. And in case you were wondering, there are a few perks AmeriCorps members get, including money to pay for college, student loan deferment, training, living allowance, health benefits, and job opportunities with leading employers. Not too bad, right? All right. What's the purpose of AmeriCorps? Like the military or the Peace Corps, AmeriCorps is a way to serve your country. AmeriCorps members make Americans safer, stronger, and healthier, and they strengthen our communities. But above all, AmeriCorps members get things done. That's it. That's what AmeriCorps is. Learn more about AmeriCorps at AmeriCorps.gov.
Yeah, so pretty exciting stuff. If you are not familiar with AmeriCorps, it is a domestic Peace Corps model. We are in all states, including all US territories. And this is a quick snapshot of what's going on in Washington. This is always a bit of a point in time, so it could fluctuate up or down. Right now, we have about 900 local service sites, 5,600 AmeriCorps seniors and AmeriCorps members. We bring in about 34.7 million in AmeriCorps funding, as well as local funding on an annual basis. And then with AmeriCorps being created in 1994, since the inception, as far as Washington goes, we have given out over $175 million in AmeriCorps educational scholarships. And again, just a quick note on the Public Health Corps, Public Health AmeriCorps. I do tend to shorten it sometimes, and I'm not supposed to. It's Public Health AmeriCorps. It's very similar to the traditional direct service AmeriCorps model, calling attention to the area of public health in collaboration with the CDC. While it is a separate notice of funding opportunity, this entire call will still be applicable, and we will call out just a few differences at the very end of the call pertaining to PHA. So if you are here specifically interested in PHA, you're still in the right place. This entire call is still applicable to you, and you will want to stay until the very, very end. If you're not here for PHA, there will be time to answer general questions before we go into those specifics on PHA, and then you can depart a few minutes early. So let's get to the purpose of AmeriCorps state funding. AmeriCorps brings people together to tackle some of the country's most pressing challenges through national service and volunteering. AmeriCorps members and volunteers serve with organizations dedicated to improvement of communities. AmeriCorps helps make service a cornerstone of our national culture. To achieve this end, AmeriCorps funding is awarded to eligible organizations that propose to engage AmeriCorps members in evidence-informed and evidence-based interventions to strengthen communities. State service commissions, like Serve Washington, receive AmeriCorps state funding from the federal agency AmeriCorps, previously known as the Corporation for National and Community Service, or CNCS, but they now are doing business just as AmeriCorps. Serve Washington then passes this funding through to local programs. AmeriCorps funds are funneled through state service commissions and other territories by way of two different funding streams. First, we have our AmeriCorps state funding that is a competitive funding application. That is this current process that we are all in and occurs each fall. Second is the AmeriCorps state formula funding process, and that process occurs each spring when funds are available. Let's talk a little bit about both of those opportunities. The fall competitive process, this current process for this RFGA, or request for grant application, Serve Washington reviews these applications and identifies which projects will move forward to a national competition. At that point, AmeriCorps, the federal agency, evaluates the applications and determines which will be funded. AmeriCorps, the federal agency, has approximately $400 million to award, part of which is already dedicated to continuation grants in good standing. Believe it or not, those millions go pretty quickly when spread across the nation and US territories. We believe this will be a very competitive process. This competition is a good fit for larger programs, folks that are looking for at least a team of 20 members, programs that meet the national priorities, programs that propose to operate in one single focus area or have a very well-established and well-proven multiple focus area, and or programs with moderate to strong evidence. Of course, we do welcome all applications, but those are examples of the most successful based on past competitions. In contrast, the spring formula process is the local state competition. The applications in the formula competition only compete against applicants in our state. They are not forwarded to compete against other programs across the nation. And the funding decisions are made directly by Serve Washington. The formula process, however, does have a much smaller allocation of money to draw from, around 4 million as opposed to that 400 million. But the formula competition is still a really good fit for smaller programs, maybe those looking for a smaller team, around 10 to 30 members. Programs that meet local priorities, programs that propose to operate in newly established focus areas, and are programs that are just building their evidence base. We bring this to your attention just in case you determine the formula competition is a better fit. Serve Washington projects the next formula competition to occur in spring of 2023. Overall, the focus of AmeriCorps funding is guided by the Serve America Act. In April of 2009, the Edward M. Kennedy Serve America Act was signed into law by President Obama. Through this law, Congress directed AmeriCorps, the federal agency, to focus national service in 6 areas where service can make a major impact: disaster services, economic opportunity, education, environmental stewardship, healthy futures, and veterans and military families. These historic areas of focus have been well funded in the past, but applicants may apply for funding under any focus area that proposes to use AmeriCorps members, again, in those evidence-informed or evidence-based interventions to strengthen communities. Priority funding areas are determined annually by AmeriCorps and do change quite frequently. So this is a little different than those focus areas. This year's funding priorities are organizations leading service in underrepresented or underserved communities, focus areas such as veterans and military families and environmental stewardship, models that develop workforce pathways for AmeriCorps members and promote other enhanced member benefits, faith-based organizations, something called the Economic Mobility Corps, which you can find the definition of in our materials, and any established evidence-based AmeriCorps model. And again, there is a special NOFO just for Public Health AmeriCorps. Please use the NOFO and supplemental guidance on our website to see specifics and associated definitions. If your application fits one of these priorities, you have the opportunity to identify that in the grant application narrative. This portion of the narrative is not scored. It just allows for a funding priority in some cases. If your application doesn't fit in one of these priorities, please don't worry. Many applications are funded each year outside of these priority areas. Do not try to conform your application or program design unnecessarily, as it could result in mission drift or a difficult read for reviewers. Just stick to what you know. Essentially, either you fit or you don't in this category, and there is no need to waste valuable narrative space if you don't fit. You can always simply put not applicable. Washington always sets through our state service plan, our priority funding areas as well. Those are similar to the national. It just happened to kind of look similar this year, but for the last 3 years, our priority areas have been service strategies that are driven by community identified priorities. So giving that control and that power back to local communities. Organizations that are led and staffed by people that reflect the communities being served. Programs that strive to recruit and select national service members that also reflect communities being served, models that utilize service as a strategy to develop career pathways, address the housing crisis, support child wellness, and tackle climate change. We are also interested in any replicated or proven models from other states that can support local Washington needs, and also models that engage adults 55 and over. Washington also seeks to ensure resources are available to tribes, rural, and other underrepresented communities, and results in a geographically diverse portfolio of programs. So we're going to pivot now and talk about the exciting piece, the AmeriCorps members themselves. AmeriCorps members must spend a majority of their time participating in direct services. Direct service addresses human need or the environment in one form or another. It is engaging directly with people to support change. or performing service that is involved in creating community impact. Administrative tasks necessary to perform direct service are inherent. However, programs should caution against excessive administrative tasks or administrative tasks unrelated to direct service. We also have indirect service, which is defined as training and fundraising, which can be allowable for the AmeriCorps member, but limited. The most important piece of information to relay today is that at least 70% of member time must be spent doing direct service. A maximum of 20% of time can be dedicated to training, and a maximum of 10% of each member's time can be dedicated to fundraising. If this doesn't quite jive with you and you're looking for a capacity building position as opposed to direct service, you may want to research AmeriCorps Vista, which is more of a capacity building kind of interfacing position for organizations. Another quick caution, AmeriCorps is not intended to duplicate activities already available in the locality of your program, and organizations may not displace or supplant an employee or volunteer position with an AmeriCorps position. It's helpful to remember that AmeriCorps members serve or perform service and are defined by law as a participant in approved national service position. AmeriCorps members are not employees of your organization or our government, and entities should refrain from language such as work or job when describing service. With that, I'm going to pass it over to my colleague, Jenny, to talk about eligibility, process, and timeline. Welcome, Jenny.
Thank you, Robin. All right. Up front, I want to draw your attention to the requirement for a minimum number of member service years, or MSYs, as we refer to them. This is a standard of Serve Washington. An MSY is equivalent to one 1,700-hour full-time position, which is like an FTE in the employer-employee world. Serve Washington will be forwarding applications with a minimum of 20 MSY. This can be a combination of full-time or less than full-time MSYs. Organizations interested in less than 20 MSYs, so a smaller team or individual placements, can consult our RFGA for other resources. We are happy to get you connected and work with you to get you AmeriCorps members. Provided then that your organization meets the 20 member service year requirement, the following entities are eligible to apply: nonprofit organizations, institutions of higher education, state and local governments, and federally recognized, tribal governments. Federally recognized tribes should apply directly to AmeriCorps as per the NOFO instructions. Organizations must also have a UEI number. That's a unique entity identifier, an EIN, which is the employer identification number, and must be registered in SAM, the US government's System for Awards Management. Lots of acronyms here, and if any of that language is new to you, please refer to the NOFO for more. Then finally, to be eligible, the project award period, which is a full year, must begin no earlier than August 1st, 2023, and no later than January 1st of 2024. These dates are also referenced in the RFGA FAQs. So I know on our team, we have some visual learners, so we mapped out what this process looks like. So anybody who's interested in applying follows the NOFO instructions or RFGA instructions, submitting their grant in eGrants. Then our Serve Washington Commission will review and vote on which applications to forward on. If they are selected to be forward on, applicants will go through a clarification period with Serve Washington staff. And then that application, that clarified application, gets submitted to AmeriCorps. AmeriCorps then reviews and have clarification for selected member or organizations, applicants, and then awards are made. And then finally, you get a program and AmeriCorps members to help your organization and community. So the timeline for those steps is also in the RFGA, but really wanted to highlight some important dates for you all today. Today, we're having September 20th, we're having the technical assistance calls, and this is the big date to mark in your calendars. Completed applications are due from applicants on October 19th at 5 p.m. Don't just mark down the date, mark down that time of 5 p.m. Then Serve Washington staff reviews for compliance and then sends to our grant review committee to review between October 24th and November 17th. November 18th is the date that our grant review committee gets together to create a proposal to take to the full commission. Occasionally, our grant review committee wants to give a call to applicants to get additional information or clarity. This isn't an interview and it's not guaranteed that everybody will get a call, and that's not an indication either way, but you do need to make sure you're available by phone on November 18th. We then begin that clarification on November 21st. December 8th is when our commission actually does the vote, and we begin notifying applicants of that vote on December 12th. Then we have a period of doing that clarification, and we at Serve Washington will submit those final applications into AmeriCorps by January 4th. Then it will be mid-April when AmeriCorps notifies successful applicants and have a clarification review period, and the official notice of grant award letters come out mid-July. So that's kind of our timeline. More on that, this timeline and more on the process is found in the RFGA. And I think now I turn it back over to Robin.
Yeah, thanks, Jenny. It is quite a lengthy period because of the kind of dual review process, both at the state and federal level. We're going to go over some defining terms. So you've heard us reference the NOFO and RFGA, a lot of acronyms in our world, as Jenny mentioned. The NOFO, or Notice of Funding Opportunity, is the federal opportunity by way in which we at the State Commission apply on your behalf. It also outlines how to apply and what to include in your application. So it is an important document for you to know about, but the RFGA, or Request for Grant Application, is really the Serve Washington notice that you're applying to. I think we already touched on the difference between competitive and formula, but just as a refresher, this is the competitive competition, quote unquote, competes nationally every fall, and the formula, the state competition, competes at the state level most every spring. And we do project we will have funding available for spring of 2023. You may also hear or see terms cost reimbursement and fixed amount. This is the type of financial arrangement in your grant agreement. All new applicants must apply under the cost reimbursement model. This model has a detailed line item proposed budget with a required percentage of match that must be documented. It does look like most standard grant application budgets. On the flip side, the fixed amount model is a bit different, and you have to get permission to apply as a fixed amount grant. Fixed amount grants are reimbursed based on a monthly flat rate, which is tied to the number of members actively in service. Fixed amount grants do not have a required match, and do not report on their match, but must still provide program income to operate successfully. While there can be benefits to the fixed amount model, it requires a lot of autonomy and therefore has to be an earned status. So if you are brand new, you're just going to follow that cost reimbursement process. If you've been previously given permission to apply as a fixed amount grant, you may follow that. Lastly, you may hear terms such as new grantee, recompete grantee, and continuation grantee. Again, new grantees are just that, brand new to AmeriCorps funding in Washington. So if you're operating in another state, you would still be considered new if this is your first attempt in Washington. Recompetes are those applicants who have finished a 3-year cycle and are looking for a new 3-year cycle, again, within Washington. And continuations are those currently funded entering year 2 or year 3 of your 3-year cycle. Continuations have a later call today specific to their application, and if in good standing, continuation applicants do have priority funding. New and recompete grantees, you do compete head-to-head for new grant awards. Okay, so let's do a little bit of the NOFO and RFGA highlights. Our goal is not to regurgitate or read the entire RFGA or NOFO. If you've had a chance to look at them, if you've printed them out, it's quite a big document to digest, but it is really worth your time to go page by page. We're just going to cover some highlights. As you read through the RFGA, so the Washington State Request for Grant Application, that is what you're going to pay attention to. The NOFO, again, which is the federal NOFO that the commission is using, have different dates that do not apply to you. The NOFO is designed for commissions, national directs, those are big AmeriCorps programs operating in multiple states, and federally recognized tribes. Commissions, national directs, and tribes apply directly to AmeriCorps, the federal agency. You apply to serve Washington as a subgrantee operating in Washington only. So please follow those dates in the RFGA. Also, as you're reading and gleaning information from the NOFO on the criteria, there may be some times where it states to send your documents to additional documents at cns.gov. Please ignore that. Again, that's something we will do on your behalf. You should not be sending anything to the federal agency. If the instructions or NOFO direct applicants to send documents to AmeriCorps, the federal agency, please instead send those documents to Serve Washington, and our email address, which is in the RFGA, is servewa@ofm.wa.gov. Switching gears, let's highlight a lot of the NOFO that does apply to you. So first and foremost, page limits. Applications may not exceed 10 pages this year. These page limits apply to a 1-page face sheet that's going to automatically populate when you fill out everything in the grants management system. It's going to pre-populate your very first page. So unfortunately, you lose 1 page right off the bat. And then the next 9 pages include your narrative sections. And those narrative sections in the NOFO are the executive summary, the program design, and the organizational capability. Okay, so just the main narrative questions. There's a lot of information you're going to input that doesn't count. The evaluation plan and a report. If you're new, this doesn't even apply, but if you're recompeting and you have to do an evaluation plan or report, that's not part of your page limits. All of you will fill out a logic model, an actual budget, your performance measures in your performance measure module, and any other supplemental documents that you submit. All of those pieces are not considered part of the page limits. While this is all outlined in the NOFO, essentially only your actual written narratives count for your page limits. The narratives have changed significantly. There is more criteria under each narrative section and yet fewer pages. it would be wise to look at the scoring for each narrative and dedicate space accordingly. Just a reminder, the funding priority narrative isn't scored, so only address this section if applicable. Otherwise, you could be wasting valuable space. AmeriCorps has also removed the budget, like written narrative. Your budgets are now solely scored on the actual budget, so that section actually saves you space. Finally, there is a theme throughout the application that has been new over the last couple of years. So where possible, please be sure to include information on historically excluded or underrepresented communities and communities affected by structural and or institutional inequities. You will see this reference throughout the NOFO. This funding requires a cost share. First-time cost reimbursement applicants are required to provide a cost match of 24% each year for the first 3-year funding period. That match then increases in future funding years all the way up to a 50-50 split if you're awarded the whole time through year 10. We would like to also note that a 24% match may or may not be enough to operate. That's just a random statutory number that's been around for a couple decades now. While the federal share can be upwards of $23,000 per MSY, that's the most you can ask for from the federal government, successful programs in our portfolio currently report that an overall cost per MSY is more like $30,000 to $40,000, depending on program design. So no matter if you are a cost reimbursable program with a required percentage of match or a fixed amount grant where you're not necessarily reporting and tracking your match, the fact of the matter is there is a substantial cash and in-kind need to operate successful AmeriCorps programs. This year, the maximum cost per MSY, the amount you can ask for from the feds, is $23,000. This is a bit of an increase from previous years, but we also want to draw your attention to the cost side of that equation. The minimum living allowance for a full-time member is $17,600, and the living allowance range is up to $35,200. So you don't have to pay the minimum. There's actually a range in which you decide how much you're going to put forth in a living allowance. But based on that federal share, you can see that you're going to have to make up a difference. That said, many programs are looking to pay a higher living allowance and striving to raise funds for equitable wages. These awards are intended to be a public-private partnership, and the federal government has never been the sole funder. Couple more quick notes. First, on criminal history checks. Do not forget to budget for criminal history checks. AmeriCorps' federal statute requires a very specific guidance or guide in the area of criminal history checks. The statute is most likely different from a standard organization policy. People don't believe me when I say that, but honestly, our statute is very unique and your HR policies are most likely not the same. In short, every staff and member on this grant will receive a check of the National Sex Offender Public website, a state of service check, which in Washington is known as the Watch check through the Washington State Patrol, a state of residence check if applying or moving from outside of Washington, and a full FBI fingerprint check. Each check must be completed, reviewed, or what we call adjudicated, and well documented before a staff or member can begin work on the grant. We provided what we believe is the approximate cost for these checks when using AmeriCorps resources. Right now, it's about $68 in Washington per person. This is going to cover the sex offender check, the Watch check, and the FBI check. If you are planning or want to take into consider costs for out-of-state checks, you'll want to raise that a little bit. Again, these are the projected costs when using the AmeriCorps vendors, which you will be taught how to use those vendors once you get an award. And finally, prohibited and unallowable activities. By law, there are a number of activities not allowed, such as attempting to influence legislation, engaging in religious instruction, providing a direct benefit to a for-profit business, providing abortion services or referrals, duplicating services, displacing paid workers, and the list goes on. If you're a brand new applicant or new to this concept, please consult the supplemental guidance for the full definition so that you are not inadvertently proposing a program model with prohibited or unallowable activities. We do want to draw your attention to the weighting of the application and note that the application itself contains 4 major categories, each worth a different percentage that reviewers will grade your application merit on. The executive summary is required by all but is not scored. It's a pre-populated short paragraph. Next is your program design, and this is the most heavily weighted. It's at 50%, followed by organizational capacity, 25%, and then the actual budget you submit will also be scored at 25%. Recompetes, please do remember the narrative questions have changed, so pay attention. Please do not copy and paste your last application or rely on your previous application headings. Because the program design section of the application is worth the most points, we felt it would be worthwhile to spend some time discussing it today. Lou is going to give an overview of the AmeriCorps definition of theory of change and discuss the requirements for evidence. Thank you, Lou.
Yes, thank you, Robin. So we want to take this opportunity to highlight a broader topic, AmeriCorps' definition of theory of change, which has 3 basic elements. There's the problem need statement, the evidence-based intervention, and the intended outcome. An aligned theory of change has an assumed cause and effect relationship. So let's talk about each element. First, excuse me, is the problem need. The problem is the negative condition that exists in the service area proposed, while the need explains the scope, significance, and cause of the problem. The problem need statement answers questions such as who's affected, how many, how severe is this problem? It also answers the question, so what? What will likely happen if nothing is done about this? And finally, why does the problem exist and how is it perpetuated? The problem need statement should also reflect statistics and data sources that are as reputable, current, and local as possible. So a word of caution here about really lengthy problem statements that outline every possible negative condition in a service area, even if it's irrelevant to the proposed intervention and outcome. I encourage applicants to consider how you might apply an equity lens when writing the theory of change in general, and how you're describing the problem, but also specifically related to answering the question of cause when we're describing the community problem that we want to address. So there is some language from the Equity Language Guide from the Governor's Interagency Council on Health Disparities. This is an invitation again to be explicit in your narrative about why the problem you're addressing exists in the first place. So state data have consistently pointed to differences in access and outcomes experienced by people of color. Examples include gaps in kindergarten readiness, disproportionality in the criminal justice system, disproportionate exposure to environmental hazards, and health inequities. When documenting these inequities, agencies historically have used language that explicitly states or implies that race or ethnicity is the risk factor. And the council's guidance to agencies now is to be explicit about racism and other forms of oppression as the underlying causes for the inequities that exist and show up in government data. Such inequities may be due to overt interpersonal racism or institutional racism that results in policies or processes having disparate adverse impacts on people of color. So if you decide to share information on outcomes by race or ethnicity, we encourage you to include context about the underlying reasons, including lack of opportunity or policies that have a disparate impact on people of color, the effects of implicit bias on subjective decision-making, toxic stress, etc. But also be sure to include why it's relevant to your program. Again, we don't want this to become a data dump, so only include it if it is actually relevant to your program design. You might want to reference our recorded training grant writing from the July 2020 subgrantee meeting, which is posted on our website under subgrantee resources, meeting materials. So now let's talk about the intervention. The intervention is a set of activities that will produce the intended outcome. It's important to clearly define each aspect of the intervention. Don't assume that the reader understands your intentions, especially if your program uses a general intervention, such as tutoring or mentoring. The design and dosage, which includes the frequency, intensity, and duration of intervention, should all be well defined. So you would be answering the questions: who does what with whom, how often, how many times, and for what proposed length of time. And here, a word of caution about interventions that are defined in general terms but don't have detail or supportive evidence. So now let's talk about evidence. The level of evidence in support of the intervention increases the likelihood of the cause and effect relationship in your theory of change. The NOFO and supplemental guidance outline a spectrum of evidence. While we encourage the use of evidence-based and evidence-informed intervention, we know that not all programs will fall in the moderate or strong evidence tiers as defined by the NOFO, and that's okay. AmeriCorps acknowledges currently funded applications fall all across the spectrum, and many programs are in the preliminary stages of evidence. The hope is that over time, the AmeriCorps portfolio will shift as programs gain traction in the area of evaluation and will build upon their program's evidence. Now we move to the intended outcome, which is simply the change that you hope to see. And a word of caution here about outcomes that are really difficult to measure in one program year or that don't fully align with your proposed intervention and need. Now let's talk about the logic model. Your program's logic model should be a snapshot of your program's theory of change. And just a reminder, keep the logic model to 3 pages maximum. We suggest using bullet points or short phrases rather than full sentences throughout the logic model. When read left to right, the logic model answers the question, if then. If we have 20 AmeriCorps members, then 400 students will receive services, and on throughout the chart. You could also read it backwards, right to left, and then it would answer the question, but how? So 400 students need services requiring 20 AmeriCorps members, for example. The logic model also encompasses short, medium, and/or long-term outcomes. This may represent time or conditional change. Think ABC, attitude, behavior, condition. Also, it's very important to note that not all of the outcomes that you put in your logic model require an associated performance measure. Again, the logic model is relative to a full theory of change. So your program may choose to only measure one of the outputs with one aligned, usually short-term outcome. Medium or longer-term outcomes may be more relevant for an evaluation or may simply represent an ultimate change in condition established through cause and effect. But are not within your program's means to measure in one program year. Choose whatever makes the most sense for your program. It all depends on the program design, but just know that you're not required to develop performance measures for all of the outputs and outcomes that you have in your logic model. When all three elements are laid out, both in the written theory of change and the logic model snapshot, each should read like a story or a blueprint from point A to point B. Alignment throughout the elements is critical. The grant reader should be able to envision a day in the life of your program. Now, this is newer. In the application narrative, applicants should discuss the community need as it relates to the CDC's Social Vulnerability Index. And a note that when you go into the index map, if you zoom in enough, you will get data at the census block level rather than the county level. And we see this index as one more data source for determining community need and selecting service location areas. It's not necessarily the only data source that you would use and reference in your application. So I have a few points to share on the performance measures now and the performance measure module. All applicants must include at least one aligned performance measure, which would be an output and an outcome that corresponds to the proposed primary intervention. This may be a national performance measure, or it could be an applicant determined measure if none of the national performance measures accurately captures your intervention. Performance measures reflecting activities that are not central to your program model should not be included in your application and do not need to be reported to AmeriCorps, although you might still collect the data for your own purposes. Using our previous logic model example, this is what a program might choose for their performance measure. The output of 400 students served, and of those 400 students, 275 will improve math scores by 10% or greater. A common pitfall we see in the performance measure modules are really lengthy problem statements, as well as long paragraphs under the described instrument section. So just note that the problem statement can be a quick 2 to 3 sentence summary, as the example on the slide demonstrates. So the sample problem statement reads, many students are not reaching 3rd grade reading level benchmarks. Research shows when students get behind, they often stay behind. So that's an example of what we're looking for. It can be really short. Likewise, the described instrument section should be kept as brief as possible while also including enough information for the reviewer to assess. For your outcome performance measures, described instrument statement, you should be sure to specify who's counted. For example, only those who complete the full dosage. You would also explain the change required between pre and post to be counted and indicate how this change is significant or meaningful. And we have included an example on the slide, which reads, a pre and post student engagement assessment will be completed by all students who attend at least 4 sessions. Students must demonstrate at least a 25% improvement on the assessment to be counted as improved. We know that many students without support become less engaged, so any improvement can be considered significant. So that's just an example for you. The theory of change and evidence narrative is where you'll capture the most robust details, not in the performance measurement module or the logic model. A little more on evidence now. You might reference the NOFO and supplemental guidance. But in the narrative section, applicants should fully summarize any study designs and key findings of any evaluations, and also describe any other evidence that supports the proposed program design, such as past performance data or other research findings. And you would describe that all directly in the narrative section. This section of the narrative is scored on two parts: the level of evidence, or tier, as AmeriCorps calls it, and the quality of evidence. The level of evidence, or AmeriCorps tier, is defined in the supplemental guidance. Tiers include pre-preliminary, preliminary, moderate, and strong. The only tiers that allow for additional submissions of hard copy evaluations beyond the narrative description are preliminary, moderate, and strong evidence. Those who fall in pre-preliminary should only describe evaluations or research or data within the narrative itself. Also, eligible applicants should only submit evaluation reports that reflect the same intervention and the very same program design as your program, and only up to 2 reports. If you are recompeting and required to submit an evaluation based on evaluation requirements separate from the evaluation requirements, you should still submit that report and consider this separate document in the overall count. Essentially meaning some programs may submit up to 3 reports total. This is addressed in the NOFO evidence sections. So applicants should read that section of the NOFO carefully. And I will hand it back to Robin.
Yeah, thank you, Lou. My Word document failed me, so I don't know, Lou or other co-hosts, if anybody has the equity language guide that Lou referred to, or the CDC link on social vulnerability. If you could drop those in chat. If not, we'll make sure to get them on the slides so you can reference them later. All right, we're going to look at the documents that will accompany your application. All applicants will submit an operational and financial management survey. It sounds a little robust and overwhelming. It's actually not. It's a series of yes and no questions. You're also going to submit your organization's most recent audited financials. So this could be a single audit if your organization is subject to the federal single audit requirements. Or if you're not, if you don't get a lot of federal funding, you're probably not required to do that. You would simply submit your organization's last audited financial statement from a third-party auditor. Lou did mention the possibility of submitting evidence, so that's going to be only applicable to some of you, but that could be another submission. If you are recompeting for the very first time, so you've gone through years 1 through 3 as a new applicant, you're applying for years 4 through 6, it is the first time that you will be required to submit an evaluation plan. So after that initial cycle, we're going to actually start having folks in their second cycle start to evaluate their program. If you are recompeting for a second or subsequent time, so you've gone through your new period of years 1 through 3, you've gone through your years of 4 through 6 where you did your first plan. Now, anything after year 6, you're actually submitting a report of the previous 3 years evaluation, while also simultaneously submitting a new evaluation for the next 3 years. So that continual quality and process improvement. Lastly, if applicable, if your organization is covered under a union and your members will be doing similar work, you want to get that union concurrence. And if you are applying to us as a tribe, we do need to see that tribal eligibility. A little more on the evaluation plan for those of you in recompete. It's now a template. Back in the day, you used to put it in e-grants. There's still a section, but the instructions are going to tell you to put NA in e-grants, and you're going to actually submit your evaluation plan using the new AmeriCorps template found on our website. These evaluation plans are not scored as part of the grant making process, but if your application is awarded, these evaluation plans will be reviewed and approved by AmeriCorps, the federal agency. It is in your best interest to fully answer each criteria in the template. Please do not skip sections, and please be as detailed as possible, even if you're just assessing or projecting. If awarded and the plan is not approved, applicants will need to revise their plan and get a plan approved in a timely manner. The more work you can do now, the more you save yourself and the commission's time later. If you have questions on the evaluation plan template or how to best address a section in the template, Lou is a great resource, and she has been doing this lead work for many years and reviewing plans and knows kind of what some of the federal expectations are. So don't hesitate to reach out to Lou. Some tips, both for e-grants and the application itself. So we'll start with e-grants, which is the federal management system currently. It's extremely outdated. They've been trying to replace it for years. It is on the horizon to be replaced in the next couple of years, but it's a bit fickle. Please create your applications outside of e-grants so that you can just copy and paste into the fields. E-grants does not allow for any fancy formatting, so unfortunately, it's really hard to bold or italic. You can't really put in a crafty chart. There's not a lot of ways of being creative. The best you can really do is use all caps to separate your section headings. And then if you do want to create some type of list, maybe a dash or something, but then that also takes up space. So it is a pretty plain, pretty standard, just paragraph by paragraph written narrative. eGrants is also automatically double spacing when printing out for reviewers. So don't double space it in. That's going to duplicate your pages. Single space once you decide to copy and paste in. The spacing is not always perfect between Word and eGrants, but it's pretty close. And then you can do any manipulation in eGrants if you're a little over or a little under. Please do save and validate often when you're in eGrants. It's definitely known to be a trying system. If you're trying to do everything in a very quick last minute way, you're going to get frustrated. So give yourself early deadlines and go slow. Please use Chrome as your browser. eGrants was built and mainly made for Internet Explorer, and now that IE is gone, Chrome is the next best as far as getting full functionality. Some general application tips, so not necessarily specific to eGrants. Please do take the time to read the NOFO, the application instructions, and the supplemental guidance. If you're not detail-oriented, but someone near you is, have them go through it with a fine-tooth comb, highlighter, ask questions. It really is important to read that, even if you're returning. Things do change. You can't really put in any web addresses or URL links. Reviewers aren't able to actually click on those. They just get hard copy PDF versions. So just cite your source in the narrative, and the assumption is that your source is accurate. There's a bunch of places in the application that's going to require some numbers and data and demographics, and it might feel duplicative, but it does ask sometimes the same data, or it asks maybe in a different way, but the result is the same data. So if you update one section, think to yourself, where else did I put this information? So for example, if you're updating a target in your logic model, you most likely will also need to update that if it's part of your performance measure. If you update numbers in your budget, you may also need to update the total request in your executive summary. That face sheet, that pre-populated first page of the grant application, it's really important that you be accurate as to who the authorized rep and the program or project director is. So there's two people that you're going to identify in your application. The authorized rep has legal signing authority on behalf of your agency, which is probably a different person than your point of contact or the daily operations person identified as the project or program director. It's also going to ask you for a project and contract date. That is 1 full year. Most people will choose the 1st of the month through the last day of the 12th month. And this is not the same as your member service year. So your contract with us and AmeriCorps is for 365 days. And your member service year, whether that's 10 months, 11 months, 3 months, depending on the need, that has to fall within that 365 days. Please do print your final application, save it as a PDF or print it out so you can see what the grant reviewers see. As you input all of this information, it's really important that you review it as if you were on the grant review committee. Again, give yourself an early deadline. The system has been known to be down or challenging, and use an impartial reviewer. Many of us are really close to our projects, and that doesn't mean that it reads well to someone who's learning for the first time. And with that, we're going to pass it to Thomas for a few slides on budget tips.
Thanks, Robin. Yes, so first of all, I want to say that if you have the application instructions in front of you, they're pretty complete, so you can always refer to them for any details. But another thing to consider is that a lot of times organizations either have just a program person make up the budget, or they pass it off to a fiscal person to make a budget. And you kind of need at least some degree of interplay between the two, because a program person can make a budget that is not going to be realistic with what the fiscal practices of your organization are. And a fiscal person can do the exact opposite and not really have a realistic way of demonstrating how your program is going to run on a certain budget. So yeah, so I would just start off with that. The budget is something that, you know, it's really easy to kind of churn something out that seems like it gets the job done, but you really want to have a good roadmap for your year. You know, we don't hold you to the penny or anything, but you know, if your budget doesn't describe your actual program year at all, then it's going to be really hard for everybody to kind of figure out what's going on, to keep on budget, to make sure everything adds up. So that said, you know, when you do the narrative and the budget narrative from a fiscal point of view, I think this is the most important thing that I deal with from programs, is the budget narrative. It, to me, as a fiscal person, it describes your program to me. So you have columns that are just numbers. That's straightforward, but you also have the description. In the description, you want to put all of the calculations, and nothing is going to check your math except for me. So, you know, make sure it makes sense. Maybe run it past a couple people. Sometimes I catch mistakes, sometimes I don't. It's a lot better for your budget overall if, you know, if you have lodging for 2 nights and airfare for 2 people, but you didn't account for the fact that those people are going to be staying in different hotel rooms, then all of a sudden, you know, you find you don't have enough money in travel, something like that. So you know, just make sure that everything's adding up. Try to be clear. You know, just say 2 times, you know, X comma Y comma Z, but you didn't mean 2 times Z, you just meant 2 times X and Y. That kind of stuff is, you know, it makes things unclear in the budget. So So you can be flexible with certain categories. Like you can have the same item. It might count as a supply. It might count as training. For example, like Post-it notes. It could be a training expense if you use it for a training. It's probably an office supply that would go under supplies. But like when it comes to travel tends to be travel. So lodging, airfare, mileage, that kind of stuff. Any kind of registration fees are training. And then you want to itemize, and especially with salary and fringe benefits, don't just say staff will put such and such amount of time and here's how much money that'll cost. Every person needs to be listed individually in the budget narrative, and anybody that you put for an operational grant is going to have to be cleared by background checks. So you should have a very clear idea of who is going to be paid on the budget. And you want to do to a lesser degree, you want to do the same thing with other categories where, don't just say staff travel and put a lump sum of money in there. At least give some breakdown of what that looks like, like travel to the conference, travel to, various sites, that kind of thing, and have them a little bit separate. We can probably go to the next slide. Yes, so the indirect rate. So you could probably get a decent breakdown of this in the application, but the way it breaks down is 5% of your federal side expenditures can be charged to the federal side. And then, other than that, you can match with either 10%, which would be the fixed rate, or if you have an indirect rate for your organization, you can match with the entire indirect rate. You can take 5% of the federal side out of that amount and get it reimbursed from the federal grant if you so choose. But just remember that it's always a rate of what's in your budget. So if you make adjustments to the budget that change one side or the other, it's going to affect your indirect rate. And lastly, on the cost reimbursement grants, there's a source of funds section that is basically where you're getting your funding to have a grantee share. What you propose for source of funding should match exactly what you propose as a grantee share in your budget. We can go to the next slide. And so for fixed amount, it's a little different. You do need to put in an allowance rate. And there is a source of funds. You don't actually have a match that you report to us, but as Robin said earlier, it's going to cost more than your MSY. So you need to demonstrate that you have some funding to support members that comes from something other than this grant. And look at that checklist, and whether you're fixed or cost reimbursement, make sure that you can check off every item on that list.
Thank you, Thomas. I think a final note for recompete applicants, we drop hints throughout, but wanted to just make a slide just for you all. Please do remember that there is an increase in the maximum cost per MSY, so you may want to consider asking for more money from the federal government than in previous years, especially to offset that increase in the required living allowance, or if you're moving away from paying the minimum. There's a place for you to do your own fund development work to make that happen, but there's also the opportunity during recompete to ask for a higher cost per MSY. Don't forget those new criterias. It's really important that someone pays attention to this. I'm not going to lie, we've seen people dust off old applications in the past, and that can be really devastating for a grant review committee. So don't risk that. Don't submit your same application from 3 years ago. Do update your data, statistics, and evidence. This is evolving. You've had 3 years to gather new and relative information. We like to see that progress. And if you're using the national performance measures, just grab the national performance measure instructions, look up the number that you were previously using, see if it still exists or if there's one that's more closely aligned. They do sometimes change. Read the definitions, make sure that that's something you want to continue to opt into. And if you're not sure, verify your evaluation plan and report requirements with either your program officer or with Lou. We're winding down, a couple more slides. I want to end with another video. This is the latest PSA from the federal government called What's at Your Core, and it has our new modern logo. So let's check that out.
As AmeriCorps members and volunteers, we do more than talk about our core values. We take action and commit to making our community stronger.
At AmeriCorps, my commitment to equity gives every student a strong start.
Our compassion brings food and friendship to neighbors in need.
My determination protects parks in my community.
Now more than ever, your community needs you. What's at your core? Learn more at AmeriCorps.gov.
So that's our whoops. Sorry. Scrolling gone wild. So yeah, that's our new logo, and one that your program and your AmeriCorps members would utilize. And I know it ran really quickly. I don't know if you could notice, but there was 2 gentlemen represented by our Washington Vet Corps team. One had some Seahawks gear on, go Hawks. That's kind of cool to get that in the video. And they both had on some military looking other parts of uniforms. So very exciting to get a little piece of that in for Washington. I guess the big question is, are you ready for AmeriCorps? So we do have a readiness assessment on our website. I'm not sure how valuable after listening to this. I actually think this provides you with a better assessment, but it is available should you want to continue to dig and do an assessment on your end. And then, of course, all of our materials will be posted and are posted and on our funding opportunity page. If you do have questions, even if you know some of us, it's really important that you submit your questions to our general inbox for full transparency. We ask everyone go through that process, and a staff member assigned will get back to you. So I'm going to pause briefly. Public Health AmeriCorps, I have not forgotten about you. I have 2 slides on that, but I'm going to pause the recording and move to some Q&A. All right, recording has resumed. Let's talk a little bit about Public Health AmeriCorps. So AmeriCorps and the Centers for Disease Control and Prevention, the CDC, have joined forces to launch Public Health AmeriCorps and support the recruitment, training, and development of the next generation of public health leaders who will be ready to respond to the nation's public health needs. You can imagine after at least my first global pandemic, the importance of this and the importance of those 2 government entities coming together to see how AmeriCorps could be a response and recovery to the needs that are happening in communities. It's a very similar AmeriCorps type initiative. Everything that we talked about still applies as far as AmeriCorps members being engaged in direct service, as far as the priorities still leaning towards like workforce development and pipelines for folks, filling needs, filling gaps. It does have its own notice of funding opportunity. So if you have been to our request for grant applications funding opportunity webpage, be sure that you are looking under the Public Health AmeriCorps opportunity. I do believe you have to scroll down a little bit. We start with our traditional opportunity. And then if you scroll down, you will have all of the documents. You don't have to try to figure out which ones apply to you. We've posted ones that are applicable to public health only. So for those of you, that have been around, or for those of you that are brand new, there's a couple of nuances, and I'm not sure how this is going to land for folks because it is a little awkward and different. The NOFO in itself, because this is a partnership with the CDC and because this started last year, has a few minor modifications. So if you were to apply and get awarded, it's actually only going to be a 2-year award as we know it now. So historically, AmeriCorps awards are 3 years. This started last year, so we actually have folks in our state doing this right now. It's considered to be year 1. And so for those of you applying, in order to keep everyone kind of synced, you will enter your year 1, which is everyone else's year 2, and you will all complete at the same time. We do hope that this is something that our congressional representatives and our nation sees as a great benefit coming out of the pandemic. And we do hope the CDC would venture into another 3 years, but we just don't know. There's also some numeric differences, again, because there's a little more money available because of the CDC partnership. The cost per MSY is much higher than the traditional NOFO. So the cost per MSY in this NOFO is $28,800 per MSY instead of the $23,000 you saw earlier in our presentation. Now, the living allowance spectrum is the same. So you must pay somewhere for full-time members, somewhere in that range of $17,600 all the way up to $35,200. So again, that $28,800 is going to help you with some of those living allowance goals, but it may or may not still be enough to actually run a successful program. They are currently not requiring a cost share. So you heard us talk about the fact that there's a statute. It requires a public-private partnership. It requires a minimum of match. It starts at 24%. It goes up to 50%. Somehow they were able to waive that statutory requirement. I am here to tell you that I am not sold that $28,800 per member can still completely cover your cost for both your member benefits and the staffing necessary to run a really solid AmeriCorps program. So in Washington, we are just throwing a caution out there. While we cannot require you to include match, I think when you start to play around with numbers and budget and program design, most likely you will still want to contribute something, whether it's cash or in kind. You just don't have to meet that minimum 24%. Maybe 10% is good enough. Maybe 15% is good enough. Maybe you're flush. Maybe you're going to pay your members at that higher range and you've got a philanthropic partner or a funder that's bringing a lot of cash to the table. There are some caveats that we believe are good opportunities, but I just want to be very clear and transparent. The CDC is requiring folks in this category to go through special training opportunities. This is both at the site or program level and at the member level. And there is some very specific data elements and data tracking required. Again, we want to prove that this is working. We want to show folks that we are building the next generation of leaders and they're helping to fill that employment gap. And Washington will be lifting the MSY requirement. So you heard us talk about in the fall, we really prefer to send applications to the federal government that are sizable teams. We do feel like we have a history of getting sizable teams funded at the federal level and keeping our smaller teams in our formula. So we do have a waiver process. and we will not be requiring any number for public health AmeriCorps. So you could go with 10, you could go with 12. Anything less than 5, I'm just gonna let you know, I don't think you can like budgetarily make it work. I don't think that 28,800, times 3 is really going to get you where you need to be, because there's a certain amount of oversight and responsibility and compliance with AmeriCorps programs that's still going to create a need for staff capacity. And so we don't often see budgetarily it work out for small numbers. Luckily, we do have a state intermediary that is running a public health core AmeriCorps program. And even if you're interested in like having a member in 2 months or a year from now, we would love to connect you with our PHA state intermediary. So that's kind of what's different. And I will just open it up for any questions. I am going to stop our recording. So once again, really appreciate and thank folks for being here today to learn more about AmeriCorps.